Hey, future nurse. Up until now in this series, we've talked about air problems in the lungs. But what if I told you sometimes the lungs are working, but the problem is not the air, it's the blood flow. And if you don't understand this concept, you'll miss a lot of NCLEX questions. It is not always about the air, you have to focus on the vessels. Welcome to part 5 of our lung disease breakdown series. Today, we're focusing on pulmonary vascular diseases. These are conditions that affect blood flow in the lungs. Once you understand this, your clinical thinking is going to improve a lot. It's all about how that blood moves through those pulmonary arteries. Before we go deeper, I want you to understand something very important. Breathing is not just about air entering and leaving the lungs. It's about oxygen moving from the lungs into the bloodstream. That's the key to survival. So even if air is entering the lungs normally, if blood is not flowing properly, oxygen cannot be delivered to the body. So here's the key idea you need to lock in. Pulmonary vascular diseases equal problems with blood flow in the lungs. This is not an airflow problem. This is a perfusion problem. Perfusion is the word you need to know. And when perfusion is affected, gas exchange becomes ineffective, no matter how much air you have. This is a high-yield NCLEX topic because it forces you to connect two major body systems. You have to connect the respiratory system and the cardiovascular system. They work together. And if you can think like that, you'll answer questions faster and more accurately. It's about seeing the connection. Now let's break this into the two major conditions you need to know for your exams. Pulmonary embolism, often called PE, and pulmonary hypertension. Both are critical. Let's start with pulmonary embolism. This happens when a blood clot travels to the lungs. The clot usually starts in the legs and blocks a pulmonary artery once it reaches the lungs. So what does that mean? It means blood cannot reach part of the lung to get oxygen. Even though air is present in the lungs, there is no gas exchange because there is no blood to carry it. This is why pulmonary embolism is very dangerous and is always considered a medical emergency. Oxygen levels drop suddenly, the heart has to work much harder, and the patient can deteriorate very quickly. Now let's talk about pulmonary hypertension. This is different from a simple blockage. This is increased pressure inside the pulmonary arteries. The vessels themselves are the problem. So instead of a sudden clot, the problem is resistance to blood flow through those tight vessels. And over time, the heart becomes strained because it's pushing against all that high pressure. So whether it's a clot blocking flow in a PE or pressure making it harder to flow in hypertension, the final problem is the same: poor perfusion and reduced oxygen delivery to the body. So what symptoms should you recognize as a nurse? Look for these major warning signs. Sudden shortness of breath, chest pain, and a rapid heart rate are red flags you can't ignore. This is where your clinical thinking becomes powerful. If a patient has severe symptoms but no airway blockage, you should start thinking that maybe this is a blood flow problem, not an air problem. Here's how the NCLEX will test you. They'll give you a patient with sudden symptoms. They might mention recent immobility or surgery, and they expect you to recognize that as a PE risk. Here's your high-yield tip. Pulmonary embolism is a sudden onset. Hypertension is a gradual progression. Simple way to remember this: PE equals a plug in the vessel, a sudden blockage, and hypertension equals high pressure in the vessel. Keep it simple and you won't forget. Let's connect it all. Infectious is infection, obstructive is air can't get out, restrictive is air can't get in, neoplastic is abnormal growth, and vascular is a blood flow problem. Now you're thinking like the NCLEX. So let's summarize. Blood flow is affected, oxygen delivery is reduced, and it can be sudden or gradual. If you're ready to stop guessing and actually understand what you're studying, pass your next exam with us. Check out RN and LVN Refresher online help. We break complex topics into simple, clear explanations.